in the AHP faculty. We've also got my fellow student here, Rachel.
Hi, everyone.
Rachel's
I'm also a fellow
student
within the West, in the West Yorkshire faculty. Sorry, Ian, go on, carry on.
Sorry. So the purpose of today is really just to celebrate and share all of the Greener AHP activities that are happening this week or in South and West Yorkshire and beyond, really. So this week is Greener AHP week, and so part of this is one of our projects is to collate all the information that we could about Greener activities that are happening across West Yorkshire, and collectively bring them together and really just show off exactly what we can do, and then sort of make a plan or have any thoughts about what we can do really about going forward. So the webinar should sort of be around about an hour and a half ish. We'll have plenty of speakers. So part of our project is that we spoke with numerous people, and what we wanted to do was really just get those people in to share their thoughts and their stories really about what they've done and how they've come about doing it, and really just really celebrate that with you. So we've lined up a really good lineup of speakers. There'll be 10-minute presentations, and there'll also be some questions at the end. So feel free to ask any questions, feel free to engage in any way, give your thoughts or any comments along the way. There will be time at the end of each presentation to give some questions or some thoughts or some feedback. We will be recording the webinar, so if you could keep your cameras off, and if you do have any questions, by all means, just raise your hand, or you could put them in the chat, and Rachel will be keeping an eye on the chat for us. So first up, we've got me and Rachel. So we'll be exploring what's happening across West Yorkshire. So we'll be giving some of our findings of what we've done. We've then got Dr. Louise Marino. She'll be talking about medical nutrition, responsible innovation in health technology. We'll then have Steve Smith talking about reduce, reuse and recycle, so equipment reuse. We've then got Joe Courtney, who'll be talking about green therapy. And then Helen McElhinney will be sharing a video from South Yorkshire students about their project and their case study that they've done. So without further ado, we'll start with our project, Rachel and I's project. So next week, we will be marking 5 years since the UK government declared a climate emergency. There has been a lot of progress since then. So the NHS have committed to a net zero target, and the Greener AHP has been part of the agenda of the AHP strategy. What we really don't know, what we really don't have a handle on, is actually what's happening across West Yorkshire. So we know that there's lots of things going on, but entirely as a system, we're not really sure, what exactly is happening across the system as a kind of a systematic review, if you like. So that was one of our projects. Our project was in 2 parts. First part was a survey. So we collated some questions. We sent out these questions, and the survey was really just to explore the awareness of sustainable activities in the workplace. Wanted to see who was aware of what was going on in their workplace, whether that was in the team, department or trust. We also wanted to know about any training that was going on in the workplace, but also any barriers and facilitators as well to taking part in these sustainable activities. So we sent a survey out and we got 15 responses, and this is the demographic of our responses. So mainly occupational therapists. We also had physiotherapists, podiatrists, dietitian. We also had a hand therapist as well, and a therapy technical instructor. So when we questioned about awareness, one of our questions was, are you aware of the NHS net zero goal? And 65% were aware of the NHS net zero goal, which is great news for us. We also asked, are you aware of any of the following sustainable activities in your area? So that could have been the team, department or trust. And our results show slightly different findings depending on the area that we talked about. So most people were aware of recycling or paper use activities going on within their team, department or trust, but less people were aware of water waste or food catering, so maybe food waste strategies and things like that. We also asked about training. So our question was, have you received any training on sustainable activities in the workplace? The majority of people didn't receive any training. Those that did receive training received training on carbon literacy training, or had become aware of the Greener AHP, so maybe some training or a webinar on that. We also asked about barriers and facilitators. So we'll go through the barriers first. We grouped them into 3 themes. So one theme was governance. So within this theme, people explained that sort of perceived motivation or importance from higher management. It wasn't really being pushed by higher management, but there was also rules and regulations, which were a bit of a barrier for taking part in some of these sustainable activities. Some people highlighted resources, so particularly time would be an issue. So within their workload, having the space, particularly for things like equipment reuse, that was a bit of an issue, but also money to implement these things as well. So that seemed a bit of a barrier. Knowledge also seemed to be a bit of an issue as well. So particularly for primary care trusts and GPs, but also patient understanding as well, their knowledge of how to implement these things or to follow through these things. In terms of facilitators, there was a lot of support for these activities. So there was good patient feedback. Patient did give a lot of good feedback with regarding to these activities. There was also good staff support as well, and patient participation as well. In terms of the Greener AHP, there's also sustainability interest groups, which I guess aligns with good staff support. But there was also the fact that there was this agenda that was also a good facilitator, and the fact that there was a green plan in place as well. So I'm going to just hand over to Rachel now to speak about part 2 of our project.
Thank you, Ian. So from our surveys, we asked if people would be happy to be contacted for short 30-minute meetings, just to discuss more in detail about what kind of things are going on, what initiatives they are. So that kind of snowballed, because once we started to speak to people, they gave us other contact names, and we spoke to quite a lot of people. So we've summarised our interviews into the areas, and we've just noted down some key points because there's far too much to mention on all of them. And then the speakers we've got in are going to go in detail about some of the more interesting points that we want to hear about. So the first area, could you move the slide for me? Ian, could you possibly move the slide down? Thank you. The first area we're looking at is Bradford and District in Craven. And just to summarise the kind of projects that were going on there. Travel, they were promoting public transport that produced travel guides for people to use. They produced facilities for bicycles so people could bring their own bikes. Catering, they'd made a more sustainable menu, documenting the carbon footprint of meals and placing the lower carbon footprint meals at the top of the menu, so people who are more likely to choose them ones and not read further down the menu. And there was also digital ordering as well being trialled. For social prescribing, there was quite a bit going on there. There was gardening groups, community allotments, walking groups, tree planting, there was therapy dogs, and there was also VR headsets being used for patients to encourage them to be in nature. So there's quite a bit on that, but I think we've got somebody talking about that in more detail later. Equipment reuse was also going on, and furniture recycling. And so with the furniture recycling, they were the procurement, rather than ordering new equipment, they were seeing if any could be furniture and equipment, they were seeing if any could be recycled before they ordered new, so reupholstering chairs, things like that. Paperless, this is kind of similar for, if not fully, but everybody's moving to it for most regions, so that we're going with the paperless notes. The information for the patients was all paperless, and virtual appointments were being offered as well. If I could just move on to the next bit, Ian. I think I've mentioned the spotlight bit. Yeah, I have. That's about the furniture. So if we just move on to Leeds, I think it is next. So for Leeds, these were things like bicycles for service users were being accessed. There was cycle training and hospital grounds making road safety training, basically. So when they left the hospital, they were safe on the roads on the bikes. And there was also e-bikes available and carpooling for some staff as well. There were social prescribing allotment groups again. There was grow and cook sessions. So although they were growing the veg, they were also offering sessions to show them what afterwards, making use of it. Catering, there's waste management being trialled. There was staff training, so the catering staff were given informal training, and as a result of it, they changed the visitor and staff menu with more sustainable options on the menu, and there was reusing and recycling of plastics as well. The training that was going on is, as Ian mentioned earlier, was about carbon, which is what we found with most of the training. You could move on, Ian. Or obviously in the spotlight, we've talked about the 3 allotment sites being used for patients and about them being able to do the grow and cook sessions with them. So we have to move on to, I think it's Wakefield district next. So for Wakefield district, does it need to move on again, Ian? Yeah, that's coming up just a bit slow. So for travel, we've got patient care moving closer to patient homes, so there's less travel, e-bikes for staff and for commuting, and the we were informed about the NHS fleet where the discount on electric vehicles, but I think this is offered to every district, but just because we were told about it in this area, we've put it under here. Single-use plastic free, we think this has been, we're not sure if this is the whole of this area or it's been trialled in the canteen areas. Optimising medicines and reducing overprescribing is going on as well. Equipment reuse, that seems to be the same trend in a lot of the areas, and it's exactly the same for the paperless there. Training again is carbon literacy again for training. And we've got somebody talking about this a bit later on. So can we move to Kirklees? For Kirklees, we just got one bit of information from Kirklees. We spoke to a dietitian who had produced an informative video for celiac patients for their initial consultation, and it reduced the patient's waiting times by 2 to 3 months and dietitian's time by about 51 hours, and she'd worked out her the reduction in carbon emissions by 105 kilograms through travel, handouts, room energy emissions. So just by her producing one video, she's saved quite a lot, and there is other areas that she says she can in future develop it for. So this kind of thing is good to share throughout the regions because we could all benefit from that. Can you move on to Calderdale? So for that one, we've got shuttle buses between sites being offered. They're very similar with the paperless notes, paperless information and virtual appointments. And they've had a reorganisation of sites to reduce running costs. They also spoke about a new A&E, which is going to be energy efficient as well. And they spoke about having, so when we're trying to return equipment back to the trust, they spoke about having a generic sticker so they could reduce it anywhere. They could return it anywhere and it would all come back to the same place eventually. So people didn't have to mess about trying to find somewhere near to bring it to. They could just take it to the one place if they wanted. But to move on to the next one, Ian. So from our project, what we've learned is there's lots of people working on similar initiatives because the same things seem to come up, but they've all got different approaches, and it would be beneficial for people to share what they're doing to be able to understand if there's a better way of doing things. and overcome problems. Basically, we realised that there is research being done on these projects being performed, but not everyone's aware of it. So having that space where people can find out more is an idea as well. Funding, there's funding available for people to access, but people don't understand that as well. So, or not necessarily don't understand, but don't realise it's out there. And when I spoke about the dietetic video for celiac patients, that would be a benefit to somebody like that. Recommendations, we recommend that further investigations needed for places. We only touched on NHS, there's local authority, private sectors never been looked at by ourselves. So, and I feel like we've only just scratched the surface with the people we managed to be able to speak to. Development of a community of practice for West Yorkshire, I think that's got to be key, because there's so much information that needs to be shared between everyone, because it would help each other. And there's practices there that are really good that we've come across, and other people documenting and communicating the benefits, so using a community of practice to do that. We didn't produce case studies going into real detail, because we've took a wider look at what's going on. That's something that we should be recording as well, and exploring the scalability of projects. So can things be taken into other areas, or can they be expanded out over the region? So they're all the recommendations we've come up with. So I think that's the end of our section, Ian. Thank you. Yep. So if anybody has any questions, do you want to either put them in the comments or raise your hand, and myself and Ian will try and answer them. If not, we can move on to the end, because I think we're timing wise, we're on to the next speaker, I think. Yep.
Yeah,
Is that
think
okay,
so.
Ian? I think.
Yeah, absolutely. Yep. If there's nothing pressing, kind of move on to the next one. By all means, if you do have a questions, anything that you think of, please put them in the chat, and obviously if there's time later, we can always come back to that and have a chat about those. So next up, absolute delight to present Louise Marino. So she's going to be talking about medical nutrition, responsible innovation in health technology. So Louise, thank you for the call.
Thank you very much, and thank you for asking me to come and give my whistle-stop tour this morning. So I was asked to speak on this last month at a medical nutrition, or it wasn't actually medical nutrition, it was about medical health technology and sustainability. So next slide. So I just want to put out there, I'm not a sustainability expert. I have no credentials whatsoever. But what I am is very curious as to how we can upscale and efforts in order to save our planet. Next slide. So how bad is it? Next slide. So as we keep hearing, this year and last year was the world's warmest year. So we've had now 10 months in a row where our temperatures have been above 1.7 degrees. So we are in our first year-long breach of the key 1.5 degree warming limit. Next slide, please. So as one of the headlines said last summer, yes, it's hot, but this could be one of the coolest summers of the rest of your life. So I think it's an imperative that we all need to do something quickly, and we need to upscale, and we need to do it at pace. Next slide. Next slide. Sorry, I've got loads of breakers. And you can probably just click on all of these because there are 3 things. So I think what's the important thing to realise is that, so legislation has been brought in about plastic tax that was brought in 2022, but actually healthcare is exempt. So there is no imperative, there's nothing, we don't need to do anything, because you can, single-use plastic, obviously people are trying to phase that out within healthcare, but plastic packaging components as part of the immediate packaging can be under the exemption. So all of the crinkly packaging that's around syringes, all the plastic packaging that goes around bottles, the boxes, all of that is exempt. So as long as the packaging meets the above criteria, and the healthcare can claim exemption. So businesses can also claim exemption on the immediate packaging, on both pharmaceutical and medical nutrition products. And therein lies a big problem. So because we are trying to imply voluntary action, we're not compelled to change. So people don't feel that there is compunction to do anything different. Next slide, please. So healthcare is the 5th largest emitter of greenhouse gases annually. So although we are in the we are meant to be preventing problems, we're actually creating them. So again, we need to change based on this, and we need to be more aware of the impact that we are collectively having. Next slide. So this is I've taken this from another presentation that was done, and this is Maria Kojek. She is an artist in the Netherlands, and she had a mastectomy done, and she asked the team that were doing her surgery to collect all of the disposable stuff that was being used as part of her surgery. So this was one surgery, and this is the amount of stuff that was thrown away. So I suppose the question back to everyone is, when did healthcare become so disposable? When did we start throwing away scrubs? When did we start throwing away metal? Why do we think it's all right to just dispose of all of this stuff? And why can't we go back to the culture where we autoclave things? I'm so old that when I first started practicing as a dietitian, we used glass bottles, and we used to go to theatre. I used to work in South Africa. We used to go to theatre and go and get the glass bottles that we used as part of a surgical procedure, and then we would put all of our enteral feeds in there. So, you know, unknowingly we were sustainable, but then we obviously everyone went to plastic. Next slide. So I think part of the problem is that this is really complicated. I get confused by the waste disposal chart. I never know which bag I'm meant to be putting it in. So as a result, this doesn't compel us to think about a circular economy for plastic. So at the moment, a lot of it goes to high waste incineration because it's considered contaminated waste. Next slide. So currently 95% goes to landfill or waste to energy. And perhaps if we made this less complicated, there may be better compliance with thinking about where it could go. Next slide. So I think we need to stop talking about quaternary and incineration as being part of recycling. It's not, it's a linear practice. It doesn't include circularity, and it's wasteful. It's not an effective fuel. So we need to work collectively with industry to think about how we can do primary, secondary and tertiary recycling. And again, this needs to be at scale. So although there are some chemical feedstock recyclers at the moment, this is still very much in small scale stages, and it needs to be en masse. Next slide. Next slide. So if we think about the NHS data supply chain, so there are 290 different trusts, and they use 150 million Luer-Lock syringes, and that doesn't include enteral feed syringes, and that was in 2015. So at the moment, it's estimated there's almost 800,000 enteral feeding tubes used in hospital per annum, and there's around an estimated 40,000 adults and children are enterally fed at home. And there are around 40 million units of medical nutrition products in the plastic packaging used per annum. So that's an awful lot of plastic packaging, the majority of which is still going to high waste incineration. Next slide, please. So at the moment, there's about 156 tonnes of clinical waste per year that's sent to high waste incineration, and that's the equivalent of around 400 loaded jumbo jets of waste. And at the moment, the NHS spends 700 million per annum on waste management. So again, if we were more effective in the way that we thought about waste, we could not only reduce the impact it has on the planet, but also the cost impact. Next slide. We can probably go to the next slide. This is a very interesting study, and I'm really happy to send it round. So I'm a paediatric dietitian by profession, so I'm really interested in children's nutrition. So again, the advent of the last, 10, 15 years, we've had these very small, ready-to-use infant formula, and the ready-to-use was very beneficial because it reduced bacterial contamination. But the problem now is that these are not easily recyclable, and at the moment you can't recycle these little bottles, and we can't also recycle the teats. So if you think, this was a study that was done in Ireland, and they looked at 5 maternity hospitals, 14 general hospitals, and they estimated there's around 668,000 births per annum. So they estimated in the first 8 days of a baby's life, there are around almost 800,000 of these small baby bottles used. That's just 8 days, not over the whole year. So if we take that on and we think about how many babies are born in England and Wales, that's around 600,000 births per annum. So just in 8 days, people are using 7 million bottles, of which none of these can be recycled. So these are all going to high waste incineration. So 40% of the waste from these small bottles is made from plastics that bear no recycling code on them. So you can't tell what type of plastic it is. So again, we need to work with manufacturers and researchers, public health and others, to kind of redesign these products so that there is it makes they are more readily recyclable. Next slide, please. So this is some fantastic work that's been done at Newcastle Hospital. So they were the first to declare a climate emergency in June 2019, and they've joined forces with Newcastle Council and Newcastle University. So they've got a great website, and freely available stuff on it. Next slide. So again, they've been very open and transparent about how they're calculating their carbon emissions, and this is their ambition. But as you can see, although they have really had some great successes, they've got a PhD student, they're transparent on reporting their data, they've got great annual engagement, they're not able to move the needle. And again, we need to probably think big scale rather than small scale and do things en masse and join everything up. Next slide. So, and again, so although Nutrition and other companies, that Nutrition not just alone, although they say you can recycle things, a lot of things are technically not recyclable at the moment. So it's slightly disingenuous, because although it says it can be, actually we can't. So a lot of these things can't currently be recycled. Next slide. And although they've come out with some projects that they've done in collaboration with Newcastle, they've got this recycling. Again, it's freely available. You can download it, of how you could do a quality improvement project. Again, it's a very small scale effort, and we need much bigger collaboration to have a much wider uptake. Next slide. And they've done a small report, which again is a fantastic efforts, but again, it's only amongst a very small proportion of people, so 104 and 28. So the thing that prevents most healthcare professionals from recycling is poor awareness, lack of time, lack of recycling facilities, and you're required to wash the item. So it adds that burden of doing something with it. Next slide. So as you can see from this chart, although they've done 90 waste audits, they're supporting quality improvement projects. They've established the single-use metal instrument recycling. They've made very small inroads in terms of their waste reduction targets. So again, they haven't really moved the needle. Next slide. Next slide. So what is the way forward? I think part of the problem is that research isn't really embedded in anything. So this is a technical memorandum. It's got lots of pages, very, very dense. But the role of research is not within this, so there's nothing reflected in here. There's a whole list of very clever people, but research is nowhere to be seen. And until we include all of this as a big circle, we're probably not going to affect much change. Next slide. And medical nutrition is really complex. So this is a schema from a paper we've just published, and again, happy to send it around. And it's a really complex system, so it can't be thought about in isolation with other things. So we need to think about it in the whole. So we need to think about catering. We need to think about patients, parents and families coming in to see their children. What are they going to eat? How do we make that more sustainable? Meals. What happens to all of the medical nutrition products? And it goes on. Next slide. So we've been trying to do a little bit of work around this. So we've published our review article. We're also doing exploring knowledge of healthcare professionals within a critical care setting, and we're doing on an international basis to try and better understand the barriers and motivators for healthcare professionals to participate in sustainable practices. And then we want to try and characterise some of those views and maybe come up with a toolkit. Next slide. Next slide. I'll click on this, it's got loads of things. So part of the things, thank you, part of the things that we make the mistake of thinking is that two errors that policy makers make with regard to behaviour change. We think we just need to get the message across. So we need to just think telling everyone that, oh no, it's really bad, we really need to do something about it. But providing knowledge and information is all that required. But I think what we are increasingly coming to understand is that actually we need to provide aspects around capability, motivation and opportunity. So unless that is underpinned throughout our interventions, we're not going to affect change. So just telling people about it is not enough. We need to provide that motivation and the opportunity to be able to do something. So maybe we need, purple bins that say actually your medical nutrition waste goes in here, and so we need to provide people with hope. We need to make people feel that actually by doing a very small thing, it's hopeful and they can do something about it, because there's so much environmental anxiety at the moment. It's making us all feel very sad. Next slide. So Health Foundation, they've highlighted some research and some 4 main areas of action. So NHS should support staff to build the skills, knowledge and dedicated time to design and implement the necessary changes. NHS leaders should be prioritising environmental sustainability, and more so from a lip service perspective. They actually need to put some money behind it. Everyone needs to align their focus on the NHS net zero, because at the moment it won't be met. And research and innovation is needed to identify the most carbon intensive aspects of care and how we can develop low carbon solutions, and building the evidence in for that. Next slide. So in summary, harmonisation is big business. We need to have collective action at scale. Lack of legislation is the biggest problem, and we have very fragmented voluntary action at the moment. So everything is insufficient, and research is needed on a big scale across the life course to make a change. Next slide. The end. Thank you. So, and I'm happy to share anything and everything from this if anyone wants to just get in touch.
Thank you very much, Louise. That's fantastic. Thank you. May I have time? Just one quick question if anybody has anything pressing. In the meantime, there's a talk this afternoon as part of a Greener AHP week. It's from a paediatric dietitian, and she's going to be looking at case studies and audits. So that's 1 o'clock today. I think Rachel's going to put a link in the chat to you, but obviously you've got Louise's email there. And so of course she's happy to take any questions, obviously. And again, if anybody's got any questions, throughout the thing, obviously we can have time at the end to chat if needs be. Okay. Any questions? Sorry, I can't see the chat or anything like that. No.
There's no questions in the chat at the moment.
Okay, right, brilliant. Well, thank you very much, Louise.
Caroline said really interesting. Thank you.
Thank you so much, and thank you for asking me again. Enjoy the rest of your day.
Thank you. So next up, we have Steve Smith. So Steve Smith is going to be talking about reduce, reuse and recycle. So again, this is kind of from another chat that we've had from our project, and we thought this would be great for Steve to tell his story about what's going on. So Steve, you're on the call.
Thank you. Good morning, all. So my name's Steve Smith. I'm a Band 4 technical instructor in the Mid Yorkshire hospitals. Next slide, please, Ian. I'm going to take you back to a project that started in 2017. So that was the challenge that was set to us within the acute hospitals, was how we can save money basically on spending within the financial year. Next slide, please. So what did we do? We simply set up a working party. It came from the service leads, of which one of the team leaders and myself were tasked with looking at the annual budget, as you can see there, of £47,247. So that was to buy all the walking aids for the acute trust for the entire year. So that's thinking of all the disciplines, occupational therapy, physiotherapy, anybody that uses the walking aids right across the district. We identified in January 2018, that was the amount that was spent there. So we would overspend by 2/3 of the way by £31,000. We'd still got another 2 months to go. Next slide, please. So what did we do? We found out that we had that amount of equipment coming in per week to our trust. Now, when you look at that total value, they are the prices that were roughly what each item cost back in 2017, 2018. So that's a weekly value of, £4,000 coming in, £16,000 to £20,000 a month. So if you looked at what our budget was for the year, you can see it quickly escalated. So as it says at the bottom there, we stopped it with immediate effect. Next slide, please, Ian. So we also identified storage. The pictures on the right hand side are our actual storage room in the acute hospitals. It shows you there, it's very, very limited, and we could only hold safely from a safety point of view for the staff and for anybody accessing it, around about 80 frames plus some crutches. But as you can see from the right hand picture, there's a lot more walking aids in there than was actually used. Next one, Ian. So we looked at how can we change this. So we had to think, did the Band 7 physio and myself, about what we could do. So we decided to do a stock take to identify what actual stocks we'd got in, run down stock, then we set new stock levels. We introduced signing out sheets for everything that was in there. And a big thing was getting the education over to the rest of the teams that were in there, because there was 5 teams accessing this equipment service, about all the way that we changed. So we were looking at how can we monitor that? How can we get feedback from the teams? What's working well? What can be improved? Next one, please, Ian. So the new stock levels that we brought in are there, as you can see. So with a total saving per month, yeah, of £17,000. So that's a big saving from what we would have had compared to what we do. Next one, please, Ian. Did it work? The top one says it. Yes, it did. Since we started this project in 2017 up to roughly the end of this financial year, that is roughly the figure that we have saved from an acute trust, and now in the community teams. We're starting to look at recouping the budget. It's all about how we've just looked at what we're using, keeping a minimum stock level in and working to that stock level. Next one, Ian, please. So we started to think then about what else could we done. And the blue bin that you can see on the top left is just something that we did to do for recycling walking aids. So we put them in certain strategic places across GP practices, in hospitals, in the atriums. We had walking aid amnesties. A big part of the work that we've started to do is linking in with the household recycling sites, because I was shocked when I found out how many walking frames, crutches, sticks, all provided by the NHS, were actually just being binned, being skipped. Nothing wrong with them. So we did a big set of work with that. We introduced the returns bins, which you can see, and sent that out to voluntary organisations and charities. Moving on, Ian, please. So this just shows one set of walking aids that was returned from the household sites. In the Wakefield district, there were 3 household sites, and they're the facts and figures and the amount that it roughly worked out that we'd saved. We've got quite a nice agreement with the acute team in the acute hospitals, in that it gets like a 60-40 split. So we get 40% of them out into the community teams. When we go in, please. We also identified that even if it's broken, it can have a scrap value. So the pictures that you can see are all the walking aid feet and the walking aid legs, where if someone changes a static frame to a wheeled frame with a pair of wheels, what happens with the other pieces here? You know, the feet can be reused, the metal can be recycled, and the plastic can be recycled. So, you know, it was working again with the trust that if we do come across these, can we link them into their recycling evidence, and can we link them into their recycling workload? Even though the money doesn't come back directly to the therapist team, it does go back into the trust. Next slide, please, Ian. And that's just a picture of the broken walking aids that were returned. Can we go in, please? Moving forward, I mentioned earlier that we started linking with the council. We also started linking with our local equipment service. This was just a photo that I took when I was down there one time, and it shows the amount of equipment that they actually recycle. Now, the council do recycle it and get the money for it back into the equipment service. But as you can see on the picture, there's a lot of frames in there. And when I had a bit of a closer look, there wasn't anything wrong with them. They could have been quite easily just kept to one side, cleaned down or autoclave cleaned and reused. But there are reasons behind why they didn't do that, because they were from other areas in our local to ourselves in Wakefield that they were different to what the Wakefield Council used, so they wouldn't use them. Next slide here, please. So in last year, just over a year ago, I moved from the acute hospital where I started this out into a new role within the community rehab teams, and we've started to do the exact same project in one of our 3 hubs across the Wakefield district. And as you can see, we've saved £1,500 so far with just recouping money and getting things back in. We've introduced the same processes as we did in the acute trust, and it's in its infancy as that. Next slide, please, Ian. And I've just popped these on. These are some things, it's lovely that I was given them, and I'm very grateful to have received them, but it's not about these. It's about how, as a therapy service, how as a larger and wider national health service, can we cut our carbon waste? Can we stop the wasting things? There's so much more that we could do with equipment. Can we go in, please? And thank you for listening. Any questions?
Thanks very much, Steve. That was great. Thank you. Yeah, as Steve said, is there any questions about this talk, about anything that Steve's doing at the moment? So just to signpost you to some sessions. Oh, Katie, I think Katie's got a question.
Oh, I guess my comment, it was just going to throw up, and it was something that Rachel had said as well. I think it just really highlights that there's pockets of things that are happening, but actually, unless we start talking to one another, the idea that Wakefield won't use certain bits of kit because it's from a different area, there's so much opportunity in there for those conversations to start happening. Not necessarily saying that it would be easy logistically, but it just seems a shame that there's so much stuff wasted if we start talking to one another about kind of getting things in place. So yeah, just great to be part of this whole thing today.
Super, thanks, Katie. Yeah, no, I completely agree. I think there is pockets going on, and yeah, it does kind of need a collective to certainly help scale things up. Absolutely. So there is there's a couple of talks. I don't know if you saw them yesterday on equipment reuse. If you haven't already seen them, hopefully that they might be recorded, so you might be able to catch them. I think Rachel's going to pop them in the chat, the details of them. So if you are interested in equipment reuse of that kind, sort of related to what Steve's doing, by all means have a look, see what's going on. Brilliant. Any other questions? Well, again, Steve, thank you very much for that talk. It was yeah, really fascinating to hear. Thank you. It's good that sort of you've documented costs and things like that, because it's always I'm a numbers person, so it always helps with me. Okay, so next up we have, if I can move this along, Joe Courtney. So Joe Courtney is going to be talking about this green therapy project. So Joe, if you are.
Okay, yeah, I hope you can hear me. So my name's Joe. I'm an occupational therapist over at Bradford District Care Trust, and for the past sort of 6 months, I've been working on this green therapy project. So if we can move on to the next slide, and I'll give some background as to how that came about. So when I was a student still at the University of Bradford, me and one of my fellow students, we did this as a role emerging placement, and we were sort of embedded within the sustainability team, which is quite unusual for an occupational therapist. But we were sort of given the task of investigating what green therapy was going on within the trust, and then to put together a sort of business proposal that would argue that we should have a dedicated green OT, essentially. And it was, I mean, the placement was pretty limited because of the time constraints, but yeah, we spent a lot of it chatting to people within the trust and the third sector and just finding out what was going on. And as part of that, we came up with a few interventions, which was a set of flashcards, which I'll go over a bit later, a sort of map of what's going on, because that was an issue we came across, that people didn't really know what was out there. And we delivered some sort of training sessions to OTs about what they could do and how to use the various things that we had tried to introduce. So anyway, yes, we presented to the board an options appraisal, and we recommended a band 7 OT with an OTA. I mean, that didn't happen, but we did get some funding from Natural England, so they ended up with me, a band 5. So yeah. Anyway, next slide, please. So we also did a survey to kick off, or I did in this role, just to find out what was going on within the trust and what people were aware of. So most OTs familiar with it, 63% familiar with the term green therapy, but when I spoke to the doctors, they didn't really know what it was. They had no knowledge of it at all, really. So yeah, OTs associate it with nature and activity and green spaces. 67% thought it was beneficial to the service users, 59% to themselves. Yeah, once I'd explained sort of to the doctors what it was all about, and they kind of understood the concept, they, 88% were aware of the mental health benefits, 82% of the physical benefits. 100% of them said that they would like to do more with their service users if possible, and most of them would like more training in the field. So yeah, we still call it green therapy, even though actually most of the staff preferred the term nature therapy. So there's a bit of an issue there, but we're not really decided what the best term is. If you can move on to the next slide. So yeah, these were sort of the barriers identified with the staff themselves: the lack of knowledge, lack of training, the resources, staff don't have the time. Service users are not able to leave our wards, so that's obviously a massive barrier to actually getting out and doing stuff in nature. A lack of motivation amongst the service users, sometimes amongst staff as well. Unfortunately, I started in November, so it was not ideal time weather-wise, so there was basically hardly anything going on. That even the usual stuff, the limited stuff that would happen, was kind of put on hold. And then everything was a bit inconsistent across the trust. There'd be one place where they'd be doing loads, and then the ward right next door, there'd be absolutely nothing, and nobody was really talking to each other, and there was a lack of communication. You want to move on to the next slide? So these were a few things going on. There's a lot of walking groups. Again, a lot of those kind of stopped over winter, but they exist in theory at least. There were gardening groups in the past, but there wasn't really when I took up the post. Now it kind of undermines one of the central problems, which is that often it comes down to what green therapy is going on, comes down to individual staff members and sort of their interest in it personally. So like we had a gardening group, we had a whole allotment and everything set up at one of our sites, our inpatient sites, by a very keen OT. But then the minute she left, it just all stopped and fell apart. And it's like, well, what's the point? Because we knew that it was benefiting service users, and then it just came to an end. So there's that issue of how to make it more sustainable. There's also, we had a community allotment. You can see a picture of it there, which our charity provided lots of money to set up, and it cost quite a bit. And then we started using it with service users in community, and community is an area really lacking in sort of green therapy. So this was our one big intervention. And then health and safety shut it down because they said that our staff hadn't done the sort of correct first aid course. And so yeah, that also just came to a close, came to a stop. But I'll come back to that later. We have some limited animal therapy. I think we used to have a lot of pat dogs, pets as therapy dogs, but most of that came to an end because of COVID. I think people just stopped doing it and then they never came back, or it was also infection prevention control became a bit stricter on things. So we currently have one therapy dog, but unfortunately, again, it is the OT on this particular ward who has the dog and has that interest. So it's just limited to that ward. She does not have the time to go around everywhere else, even though everybody else would really like that. We have some therapy rabbits, but again, just on one ward. And they will not, despite how many times I keep asking, they won't let me bring any therapy sheep onto any of the wards, sadly. So we do some sports, yeah, community allotment I mentioned. We did some mindfulness classes. That was our psychology team, and that went down really well. But to sort of just emphasize the whole problem, our psychology team also they set up a sort of green therapy project about just getting out more in the community with a third sector organization. But when they actually made that available to service users, I think only 2 people out of 600 signed up. So it never happened. But I think that is not because people don't want to do it, but because of a lack of knowledge, or sometimes it's as simple as not being able to get there. Anyway, should we move on to the next slide? So these are kind of things that I've been doing in the past 6 months. So as mentioned before, we've been trialing virtual reality because we managed to get hold of a piece of software that's actually originally been developed for dementia patients down in the south of England. But luckily for us, it is essentially just being sat outside in nature, and you're completely immersed in nature. It's an amazing experience. It's completely 360, and you can sit by the beach and you can hear the sounds and you can look around you, and etc. etc. That's gone down very well, I think, because it's an extremely easy intervention to do. You've got the headset, you probably just need one member of staff, and service users are very keen on using it because it's kind of new and novel. And so it's something, and also, as mentioned before, if they can't leave the wards, then this is a perfect solution. But also it kind of deals with that lack of interest from service users, because I think a lot of people, especially if they're from the city centre, they're not aware that we have amazing countryside just a few miles away. So this is kind of a stepping stone, the virtual reality. It's like, well, so we're actually having some videos made of places around Yorkshire, mainly around our side, West Yorkshire. So we can say to the patients, look, this is what is just a 10-minute drive away. If you want to go and do it, we can facilitate that. So we're still in the process of getting them made, and we've so far got 2 headsets to use, but we're trying to get more. But yeah, anyway, so that is an ongoing thing. We've been doing decorating bird boxes because we just want the patients to feel somehow more engaged with nature. Unfortunately, we couldn't build the bird boxes again for safety reasons, which is what our original intention was. But we've built them. We're going to get them put around our sites. We're hoping maybe to have some follow-up in terms of that nature connectedness by maybe installing a camera or something like that, and introducing some bird watching classes, that kind of thing. Here's an example of the flashcards in the bottom there with the otter on it. So that is basically, again, just getting back to this idea of a lot of the time our service users don't really understand, well, not just our service users, our staff as well, don't really know what green therapy is. So we have a series of flashcards, and there's different activities all to do with green spaces or nature. And you basically would just, it gives them a visual option if to make it easier for them. Yep, so we are getting the gardening groups going again, the ones that had shut down due to a lack of interest, because part of my job is basically to go around annoying people until they do stuff. We've got that going again. The one that had stopped because the OT had left, that's going again. We have one on our main site that's about to start up again. We're going to be growing, veg and stuff like that. And we're also going to be doing stuff around the grounds for staff as well. Because one thing that has come up over and over again is this could be really beneficial to staff, but I've just not had in the limited time frame, I've not really had that as an option yet. But we are looking at doing a staff allotment as well. The community allotment I mentioned earlier, which had shut down, we've got that going again, because basically it was one of the issues is, staff, they don't really have the time. As soon as health and safety said, we're going to have to shut that down unless you do this 3-day course, they were like, well, we don't have the time for that. So it just stopped until I came into post, and then was like negotiating between health and safety and the staff and saying, well, hang on, can you just do it in, you don't have to do it consecutive days, and things like that. So it's got done now, and everybody's doing it, and it's going again. We've been doing nature connectedness workshops, which is Yorkshire Wildlife Trust have been coming in and giving us some excellent nature training, which staff have just been so positive about and really enjoyed. And in fact, we were so oversubscribed for that. I was amazed at how many people are. It just shows that the interest is there. It's just the training isn't. And they were also basically teaching us things that we could do when you can't get out of the wards. So which is obviously really important. There was nothing on our internal SharePoint page on our internal website about any green therapy stuff. So I've kind of made a site for our. It's a shame it can't be seen by everybody, because this is a barrier, which I will get to. But yeah, so that's been done. So at least there's somewhere where people can go. Because I remember when I had the meeting with the doctors, and they were all like, "Oh, this is a great idea. So what do we do now?" But at the time, there was nothing. There was nothing to send them to really within our trust and say, well, go to this site and you can see what's happening. We're setting up a seed library in our main inpatient site, and that's going to live within the library, because again, we got a lot of wards who want to do gardening groups, but they're like, well, we don't know where to get stuff, if there was a central location. So that's happening, and yeah, we're also trying to get things going in the third sector. As I will discuss, the community angle is a bit of a difficult one, but let's move on to the next slide. So yeah, barriers and engagement. So yeah, community, it's really difficult to get stuff going there because it just seems to be so ad hoc and no one really seems to know what's going on. A lot of the time I'll speak to our community teams and I'll be like, what are you doing? And usually they won't be doing anything because they will kind of rely on third sector organizations and social prescribing. But then when I chase that up, I find that then these third sector organizations aren't really doing anything anyway. So kind of just people sort of just get lost. And this is why I mentioned discharge pathway, because it's like a lot of the time people will be doing green therapy on the wards and it will be really beneficial to them. But then when they get to community, that's it. There's no sort of follow up there. Yeah. So that's very frustrating, and we're trying to figure out ways of improving that. Like, for example, at the moment, we're looking at the community allotment we've got, whether our inpatient sites can start using that, and then it'll just be a natural transition to community. But obviously we've had the issues there, and the other issue is, I mean, I've made really good links with, there's great third sector organizations around Bradford and the area and the trust, and they're really happy to work with us. But then it's actually moving that into practice, because all I can really do is go back to our community hubs and say, okay, well, there's this organization that will work with us, but if they're too busy and they don't have the time, then nothing will happen, and we're just in the same situation as always. So yeah, staff issues, understaffed. Like I say, when a staff member moves on, especially, OTs do rotations. So you'll get an OT who spends 5 months setting something up and then they move on and that's it. It just gets forgotten about. And it's like, well, what's the point? Just a waste of time. So there's all that. There's my project, because it was originally like 6 months, I didn't really have the time to do everything we wanted to. It has been extended now, so hopefully we'll have a bit more time to explore more things. Coordination between staff and the wards, like for example, on one of our inpatient sites, we have a ward that has loads of gardening equipment but does no gardening, and then we have a ward right next to it that has no gardening equipment and wants to do loads of gardening. Those wards have never spoken to each other. They don't even know each other, and it's like, if you just communicated with each other, you could maybe work together and find a compromise there, rather than us just constantly ordering more equipment for different wards, and then it just ends up in a shed somewhere. I mean, that was kind of the idea of the seed library. It would give people a central location and they might actually be encouraged to talk to each other then. We also there was set up a communal garden within our inpatient sites, especially for OTs to use. But again, it just fell apart because the people who set it up moved on. And some of the wards that weren't part of that main building, they didn't even know it existed until I came into post and told them. So there's no communication there. So I think we have an issue here with the background of people taking part, the demographic. Bradford is a very multicultural area, and yet most of the green therapy is just undertaken by sort of white middle class people, and it tends to be in the more affluent areas. So there's an issue there, and we have been looking at ways of improving that, but we don't really have any stats, so it's kind of anecdotal, the sort of theory we have there. So yeah, as I mentioned, there's loads of bureaucracy. We couldn't use the community allotment because of health and safety. We couldn't build bird boxes because of health and safety. Whenever we try and introduce anything, it takes months to then get told no, essentially. So there's that issue. I mean, it'll be easier now because we've got a bit more time, I suppose, and we're also keen. It goes on to the next point about finding out what other people are doing. Because as far as I know, there's not just one central resource which kind of says, this is what they're doing in Sheffield and this is what they're doing here, which would be really handy because we're really keen to know what other people are doing. And also we can use that and say, well, they're doing this here and they've been fine, so why can't we do it? I was chatting to Devon NHS last week, who are doing some really interesting things, and are allowed to do a lot more than we are in terms of like taking risks. But yeah, apart from Devon and I think Nottingham NHS, that's all I've spoken to. I think I don't really know even what's going on round the corner in sort of Calderdale or whatever, because there's just not that central resource, which would be very handy. And the ultimate question, which we really struggled with, is outcome measures. This is all very well, but how do we prove that it's working? And we always feel like, and Devon said this as well, they felt like green therapy is held to a higher standard than other interventions. A lot of other interventions will just be like, oh yeah, of course you can do that. But with us, it's kind of like, oh yeah, but is it working? Can you prove that it's working? And the problem is it's very difficult to prove that. Because obviously, well, for a start, all our different teams use different outcome measures. And often they are not appropriate for our service users. If you're using a very standardized, a long form where you have to fill out a lot of information, it is not going to work. So we've been struggling with that. And if anybody has any ideas or suggestions, that would be very helpful. But at the moment, we've just been trying to keep it as simple as possible, but it has been very ad hoc. Shall we move on? So yes, I will end here. But yeah, this is sort of what we're doing at the moment. So right now, we're looking at improving the training resources, getting the gardening groups going, getting the seed library going, getting the nature flashcards have already been handed out. We want to see how they're doing. Again, it's a question of how do you measure that? How do you measure their effectiveness? The VR headset's kind of in no man's land because of the weather, because the company that are making the videos for us keep having to cancel because of the unpredictable Yorkshire weather, unfortunately. But it will get done, and then our patients will be able to experience, Ilkley more or what have you. And hopefully encourage them to actually get out there. And so in the medium term, we're trying to, so one of the big problems we've had is I will go out to, say, a community hub, and I'll say, what are you doing green therapy wise? And they'll be like, well, we're doing nothing, but that's because there is nothing. And I'll be like, there's literally a farm around the corner who are very keen to work with us, and they just will not know. And I mean, that's not their fault, because they don't know where to go for information, they don't have the time. So just something as simple as having in each of our locations, having a map which shows what's going on and what's available, like within 5 minutes, within 10 minutes. And so we're looking into that. Again, trying to find out what's going on in other trusts, whether we can swap ideas, that sort of thing, expanding our internal website to try and encourage it, and getting our comms team on it to sort of get the message out there, because again, people still aren't aware of what's happening. Longer term, we've been chatting to the University of Bradford. to sort of embed all this within the syllabus. So, you know, it's like they finish uni, they already know what we're talking about. They don't have to explain what green therapy is. We've also had conversations with them about working with their VR department to make more bespoke sort of videos and software for our VR headsets. We're still trying to get more third sector connections going because, again, that's just, yeah, there's not much going on out there. So we're planning a sort of nature day where all the organisations in Bradford who are interested in sort of green spaces, green therapy, will all get together and have a big picnic, and everybody will get to know each other and chat and hopefully form some actual, you know, long-lasting ties. There is talk of creating a research project out of this into green therapy. So obviously that would probably hopefully solve the outcome measures issue. Yeah, the VR, we're expanding, and I mean, I know this is all about green therapy, but the possibilities for that are kind of endless, because whenever I've been using it with, you know, especially OTs, they've just been like, this would be so good for graded exposure and things like that. One of the ways that we thought about helping with the diversity issue is to create a roadshow, which our psychology team had already wanted to do. So it's kind of just building on that, which would go around different areas of Bradford with, you know, certain demographics and just show off what we're doing, what it all means. Could use the VR as well to show them actually what we're talking about in terms of nature. More animal therapy. We're always keen to get more animals because everybody loves therapy dogs, especially. And so we're trying to do that. I've sort of given up on the sheep for now, but dogs and cats, we are trying to get on the wards more. So that's an ongoing thing. Yeah, more stuff for staff. I think it would really help if they experience the benefits themselves. It would definitely then encourage them to use it more. So like I mentioned before, we've got a staff allotment that's currently been put together, and the idea is that's just for staff at the moment, and maybe eventually we'll open it up to service users. And yeah, if we can sort of improve that discharge planning and incorporate it more into their care plans, and so it's all just a bit more seamless, because at the moment it's just a bit all over the place. But yeah, so there we go. I've had to give a very quick sort of presentation on that. There is a lot more that was missed out, but if you have any questions, I'd be happy to answer it, or if anybody wants to know more, you give me an email.
Thanks very much, Joe. That was fantastic. Thank you. So if you would like to know more, Joe will be doing a talk tomorrow. Have I got that right, Joe? Yep. So tomorrow. So Rachel, again, will put the details in the chat. It'll be this with a lot more detail. And you're presenting with Kathy. Have I got that right, Joe?
Yeah, I'll be presenting with our AHP lead and also my boss within the sustainability department. So it'll be a lot more in depth. We'll cover a lot more topics, but yeah.
Brilliant. Thanks very much. Has anybody got any quick questions? Maybe time for one question for Joe. No? I can't see the chat, so if there is one. Okay, right. Thanks very much. I'm going to stop sharing at this point. So next up we have.
There is none in the chat, by the way, Ian.
Right, brilliant, thank you. So next up we have Helen McElhinney. So Helen McElhinney is going to share a video with us, if that's okay, Helen. So this is Helen's students' projects from South Yorkshire. She's going to give us some details about what they've been up to. Sorry, Katie, did you have a question? I just saw your hand up there, or was that? No, okay, sorry, it's just probably a legacy on my screen. So, so Helen, I'll hand over to you if that's okay.
Lovely, thank you. So as I understand it, you're going to share the video, you're going to share the recording, is that right? Yeah, but I'll just give a little bit of context about what the students have been up to. So I just want to say morning, everybody, and thanks for having us. I'm Helen McElhinney. I'm the AHP Workforce and Faculty Lead, and I work in South Yorkshire ICB. So I'm a diagnostic radiographer and sonographer, and as you're probably aware, as an AHP faculty, we focus on AHP workforce education, training and transformation. And from October 2023 to April 2024, we had 3 cohorts of diagnostic radiography students in the AHP faculty. They were all third-year students, undergraduate students, and they were from Sheffield Hallam University. And they came to us, as I said, on our leadership placements. But they've now completed the placement, but they've kind of recorded this summary that we've talked about of what they did and how they did it. But just for a little bit of context before they start the recording. So when they came into the faculty, we really wanted a project focusing on the Greener AHP agenda. We really wanted to establish some system-wide understanding of Greener AHP activity in South Yorkshire. We really wanted to understand what AHPs were doing and which of our 15 professions were and weren't involved in Greener AHP. So we planned to gather some intelligence, collate some case studies, and then share those case studies around South Yorkshire, because we felt there were some good examples of good and innovative practice. We just needed to find it, which I think is a theme that's come through in the previous presentations. We just need to find it and share it. And we also wanted to establish what we needed to progress the Greener AHP agenda in South Yorkshire and what we could do as a faculty and a network to support. So there were challenges. We had 3 cohorts of students. They were scheduled to be with us for relatively short periods of time, and we knew this was going to be a big project. So what we chose to do was stretch the project across the three cohorts and see each leg of each cohort as a discrete leg of the whole project. So that's how we approached it. And in that way, the project was iterative, and the findings from each cohort informed the next steps. So cohort 1 started by scoping for us. They took the first steps in helping us understand what was happening in the system. They used a survey, as West Yorkshire did, explored social media platforms, and they started that collation of the case studies. And they recommended at the end that we improve the comms, improve social media presence, and collect more case studies. And as was mentioned earlier, we hadn't really got case studies from social care and primary care, so it was about really expanding where those case studies came from. So cohort 2 picked up, and I look at them as the progress parts of the whole project, and they really progressed on that preparatory work. So they developed the case studies, they worked on those recommendations, as I said, they expanded our use of social media in South Yorkshire, creating a South Yorkshire specific platform for us to develop and share content on. And they recommended at the end of their project of, again, further enhancing that communication, uploading to Future NHS and the Centre for Sustainable Healthcare, expanding TikTok, Instagram, LinkedIn, and cohort 3 that you're going to see the presentation from, they picked it up. As when we see in their recording, they'll describe what they did. They'll describe what they did and how they did it. But really, the way we look at cohort 3 is that they concluded this project for us, so by embedding a sustainable way that we can approach Greener AHP, that Greener AHP agenda in South Yorkshire for South Yorkshire AHP. So, thank you for having us, and if you'd listen to the recording, and if there's any questions at the end, I'll try and answer them.
So can somebody just tell me if they can hear the recording?
Not yet, no. I think when you share Ian, you have to click the include sound. So you might have to stop sharing and then share it again. It's right at the top, next to share content, it says share, include sound.
Hi everyone, my name is Albin. I'm here with Emily.
Just a bit quiet if you can turn the sound up.
We are third-year diagnostic radiography students doing our leadership placement with the South Yorkshire AHP faculty. So this presentation is on our final week 4 progress that we had during the placement. So our 4 aims for this placement were in during the 4 weeks were the aim one was to utilize the cohort 2, which was the previous cohort studies. They had done some case studies and we uploaded them to the Center of Sustainable Healthcare website. Aim 2 was to create a template for the case studies to be transferred into a website called Future NHS. And Aim 3 was to formulate recommendations from cohort 2's Google document findings. We had Aim 4, which was to promote the Greener AHP agenda through relevant meetings and social media platforms such as LinkedIn and Instagram. So what we've been up to, so during our 4 weeks of placement, we had multiple meetings. We had daily morning meetings with our peers to discuss what progress we had to do for that day. And we had group supervision meeting with our supervisor. She was very helpful with that meetings as well, so guided our progress as well. And then we had AHP council meetings where every Friday, usually we had a AHP council meeting where we had to present our weekly progress, and we were able to get good feedbacks and reflect upon on the next week. So we created and posted social media content on LinkedIn. We created a LinkedIn account and were able to post so on Instagram as well. So we met with West Yorkshire faculty in week 2, where we were able to inspire them, and they were able to inspire us with more and give us feedback. So we were able to discuss some resources and also share some ideas with them. The first aim was the case studies upload on Centre of Sustainable Healthcare website. This was mainly recommended by the final findings of cohort 2. So it was to prepare the case studies for upload. How we achieved this was we started this work on week 3. We were not able to finish it completely on week 3, so we had to push it forward to week 4 and allocate a full day for the whole team to work on it. We had some challenges concerning how to upload the case studies to the website. So we contacted the right people in CSH, and they were able to provide us with the right steps to convert and how to apply to upload the case studies. So now Sophie will take over to talk about the Future NHS website uploads.
Thank you, Alvin. Like Alvin mentioned, cohort 2 did give us a lot of recommendations in which we built our aims from. So aim 2, they asked us to consolidate and upload more case studies. So we took this in week 1 and we tried to familiarise ourselves with Future NHS, and we tried to figure out what it could offer the faculty for Greener AHP. In week 2, we created a template, which I'll show you on the next slide. It's so that we can put the case studies onto this template for easy management and for efficiency, and upload it to Future NHS. Week 3, as a group, we met up with our supervisor to confirm the final design. And then week 4, we transferred the case studies that cohort 2 had gathered for us and put it onto the finalised template ready for uploading. So on the next slide, as you can see, we will have the template, and as you can see, we've tried to make it eye-catching as well as informative, but not overwhelming to read. We've used Doncaster as one of the examples on this slide. As you can see, it just compacts all the information as an easy guide, and it can be applied both on the Future NHS website and any other platforms deemed necessary. On the next slide, I shall run through aim 3. So as Alvin mentioned, the Google Forms were created by cohort 2. So in week 1, we researched and analysed these findings, so that in week 2, we popped them in the PowerPoint format, so then we could present these findings to Helen and hopefully created a realistic action plan for the recommendations we created. And then also in week 2, we presented these findings and our group recommendations to the West Yorkshire students in order to share ideas, share our learning. And then week 4, we recorded this presentation, which hopefully has all our recommendations, and we can work together and use this as a good resource. On the next slide, here is some examples of this PowerPoint, as I've mentioned. It's using the findings from cohort 2, and on one side it gives some potential recommendations, which we have narrowed down to the following. On the next slide. So these are recommendations. We hoped that from these case studies, we've highlighted some potential nominations for the National CAPA Greener AHP Awards. And then by using local case studies, we're hoping to encourage and praise local involvement. Our Google analysis did highlight that emails were the highest and most important form of communication. So we think by sending out our posters via email, it allows departments to print them off, talk about them in morning huddles, hand them over to the team, and have them around the department. For those who cannot access any of our internet resources, it's still spreading awareness. We hope that you can continue to share our posters and case studies on the social media platforms that we've created. And we're hoping the social media, we can nominate specific professions as a monthly takeover. For example, diagnostic radiographers take over the Instagram account and share how they are getting involved in the sustainability programme. For future reference, we're hoping for the future NHS website to create a comment section just to allow for collaboration and sharing of ideas. And then as part of the Greener Week, we're hoping recorded webinars such as this one can be shared to those who are unable to join. And lastly, we are hoping that the AHP faculty can create a CPD package to encourage learning.
So our aim 4 is social media, and cohort 2 said we should create more content and grow the following. So we've achieved this by creating a LinkedIn account. We already had an existing TikTok and Instagram account. So once we've done this, we've then created a lot of content that can go on it. You can see a bit of the content on the right, and there'll be some more in the slides to follow. But we've increased the following on these accounts. Hopefully through this webinar as well, we will be sharing a link to the Instagram where you can find multiple links to all the other social media. We created South Yorkshire specific posters, as Sophie said, just to send out to department for those who can't access social media. And we now have around 16 posters ready to go out across Greener AHP Week and beyond that. We've also left templates that we produced with find us information, daily AHP tasks and case studies. So if anybody wants to add any more in the future, or any new centres do any more studies, they can go on there to go on CSH and future NHS. So on the next slide, should just be some examples. So this is an example of a case study in Sheffield where e-cycling was done. So lack of access to alternatives such as cars would mean there's a high number of staff commuting individually by a car. So increased carbon emissions for the NHS, and the solution was introduction of electric bikes to reduce emissions. And on the next slide, these are just some more examples of case studies. So across Sheffield, there's been medication recycling, so advising patients on unnecessary prescriptions and training staff on drug prescribing. We've got medical device transport, so using electric vans. They're reliable, they're rechargeable, and they're sustainable. Sheffield, again, has done walking aid amnesty, so this is increasing awareness of returning the walking aids so they can be reused. And Barnsley have small dressing aid recycling, so all small dressing aids will be recycled, hopefully, such like the walking aid amnesty, which means if they're recycled in-house, it's lower cost and leads to a revised unit order. On the next slide, there's just a few more case studies. So Sheffield have suggested a fuddle at the Children's Hospital, which is where they have food and they huddle and they come up with ideas around sustainability. So this could be implemented into a lot of the departments. And Barnsley have done a paperway, so they've digitalised everything within one of their trusts in therapy services. And there's just 2 examples of how anybody else, if they want to, can put case studies on and tasks. So on the next slide, so this is something we've come up for Greener AHP Week, and this is task of the day. So here's an example of task 2, which is post a selfie on social media of something sustainable you've been involved in with the hashtag Greener AHP. We're really hoping it will get people talking, and a lot of these can be posted throughout the Greener AHP week and beyond that, just to get people talking about sustainability within practice. On the next slide should be another example of a task. So task 3, which is arrange a carpool for the day or take public transport with colleagues. I think this is a good way to promote low carbon emissions from people driving to work. Just on the next slide. So this is our Instagram. So we'll leave it up for a second. If you want to use your camera and scan the QR code, you can find us there, or you can find us using the username AHP South Yorkshire. And as I said, there'll be links to all the other social media in a link tree in those profiles. So just on the next slide. So this is just the further examples of what we've done across our 4 weeks. We've posted on LinkedIn as well, so if you want to follow us there, we'd really appreciate it. And we've started to grow our following slowly in the weeks. We're hoping to get a lot more followers during Greener AHP week and keep spreading awareness. So this is just our poster that we have sent out for Greener AHP week. Hopefully, again, it just gets people talking. We've left the date, the time, just all the handles so people can get in contact. And we would hope that you would share our posters through the social media if you want to. And then just to recap, building on the progress made by cohorts 1 and 2, we've used that information and our own research to advance the development of sustainability projects. And we've collated all of this information into a resource pack designed for easy access for ongoing collaboration. So it's not just about Greener AHP week, it will continue after that week. And hopefully more and more case studies will be added just to CHS and future NHS using our templates. So these are just some reflections. I'll hand back to Alban and Sophie to go through them with you.
So this is my reflection on after my 4 weeks of placement, how much it has developed me, and it helped me to reflect and improve and understand my leadership qualities a lot. So working with such an amazing team as well helped to improve my teamwork skills as well. I was able to get an insight into how the AHP faculty work by attending all the professional meetings and getting feedbacks from them. I was able to get more exposure. So I just wanted to say I'm really grateful for this opportunity. I'm thankful for this exposure and this learning experience.
Just to echo the words of Alban, I've also enjoyed this experience. It has exposed us to the leadership roles across the South Yorkshire AHP faculty, but also across the healthcare sector. And it has really inspired me to delve deeper into what options are available to me post-graduation. The experience of placement did give me a great opportunity to work in a completely different environment. We worked from home and a lot online, and this just really helped me take ownership and accountability of my own leadership within the team, taking accountability of my own projects. So it really has helped develop my understanding of both individual and group leadership and boosted my confidence. Over to Emily.
So across my 4 weeks, I've learned a lot of but not only that, I've also learned a lot about sustainability and how I can be more sustainable in practice. So, and I have a much wider understanding of what it means to be a leader, and with the help of the work from the ICB across this placement. And I've also gained knowledge of how system-wide approaches work. So it's not just about applying sustainability in one trust, it's about applying it to the region, communicating between the regions, and applying it in a system-wide approach to get everyone talking about it, to reduce that emission and get to the net zero set by the NHS. So through taking on a range of project roles, such as organisational lead and presentation lead, I've managed to refine my skills attributed to leadership. And the most valuable thing I've taken from this is probably my confidence skills. So through a range of meetings and presentations, I built skills that I just didn't have before I started this placement. And hopefully I can use all of these in my role in the future as an allied health profession, and even consider leadership roles. So that's the end of our presentation. Thank you for listening. Again, if you could follow us on any of the social media, we'd greatly appreciate it, and keep talking about Greener AHP Week.
No, not sure.
Sorry, I think it froze then, Ian. We didn't hear you.
Oh, sorry. I wondered why everybody was frozen. If anybody's got any questions for Helen, please raise your hand, pop them in the chat. I am aware of time. So maybe if there's one quick question. No? Okay, if I could just borrow 1 to 2 minutes of your time, then we'll just finish up on here if that's okay. So can you see this okay?
Yeah, we can. Thanks, Ian.
Wonderful. Right. So my internet going slow again. Okay, we'll go with here. Okay, so just to say thank you very much. Thank you very much to the presenters for giving up your time, your efforts. You know, I know this is very much a voluntary thing, so thank you very much for that. And I know, Steve, this is your day off, so thank you for giving up your time on your day off for this. It's been very much appreciated. It wouldn't work without you. Helen, please send your thanks to your students as well for us for doing that video for us. Thank you very much for attending. Again, it wouldn't work without you. It would be just us talking amongst ourselves. And so really, really, again, thank you so much for attending. There are ways that you can get involved. Rachel's going to pop them up in the chat. There's the AHP Sustainability Network events. So they're happening all this week. By all means, feel free to have a go. I should mention, sorry, Helen is presenting this evening. So if you do want to know more about Greener AHP projects in diagnostic radiography, there is a chat that she'll be doing tonight from 7 till 7:45. Again, we'll put that in the chat, so you've got the link there for the details and things like that. There's the Greener AHP Hub. There'll be some resources there. I'm not sure how well it's used, but feel free to have a look, see what's going on there. So again, we'll put that link in the chat. And of course, you know, we're hoping that this is the start of something. So if you do feel that there's something that, you know, maybe we could be doing within West Yorkshire, please get in touch with us. Let us know your thoughts of, you know, how can we make this the start of something within West Yorkshire? You know, I think people have offered plenty of suggestions, you know, and, you know, if we can keep this ball rolling, that would be fantastic. And then just finally, feedback is always appreciated. So we've got a quick form for you to fill out, if you wouldn't mind, please. It's 5 questions, 3 of those are multiple choice. So if you wouldn't mind just very quickly filling that in, just let us know how this webinar's gone. Is there anything that we can improve? If we were to do it next year, what would it look like? It's those kind of questions, but I will stop sharing there. And again, thank you very much for everybody. Yeah, it's been great, really enjoyed it. Thank you.
Thank you, everyone. There's no questions in the chat, by the way, and so I've just been monitoring it. Thank you very much.
The recording.